All right. Well, looks like it's 3:10. We have a lot of people in the room, so let's get started. It's great to see everyone. So welcome to the Ask Me Anything event on user engagement. We are so fortunate to have two expert panelists today. Dr. Emily Lattie is the Director of Clinical Product at Lyra Health. And prior to joining Lyra, Dr. Lattie was on faculty at Northwestern University's Feinberg School of Medicine, where she led research on the design and implementation of technology-enabled mental health services. Dr. Lattie is currently the president-elect of the International Society for Research on Internet Interventions and is the past chair of the Association for Behavioral and Cognitive Therapies, Technology, and Behavioral Change Special Interest Group. Our other panelist is Nassim Bickham, she is the vice president of care transformation at TimleyCare. She is a trained clinician dedicated to using treatments proven to work. Over the past decade, she has focused on increasing access to mental health services and disseminating evidence-based practices through the use of technology at startups in Silicon Valley and throughout the nation. Her professional journey has come full circle as her own mental health journey in college inspired her down the path of becoming a practitioner and bringing solutions to the hands of those who need them. And I'm your moderator, Emily Bernstein. I'm an assistant professor at Harvard Medical School and investigator in the Center for Digital Mental Health at Massachusetts General Hospital. The goal of the session is for you, the audience, to have all of your engagement questions answered. So please raise your virtual hand, unmute yourself, go on camera, submit your questions in the chat. However you want to put your questions out there, we're excited to answer them. But to kick us off, perhaps panelists, could you just briefly share how you define engagement? At a high level, like what is this kind of magical construct? Maybe Emily, we can start with you.
Sure. First, I'm really excited to be here, and I'm excited about all the people in this room because I'm realizing how much expertise we have like collectively here. And so I'm hoping this can turn into a fun conversation as we move forward. I think about engagement in the context of digital mental health as how people are using and applying the interventions that they're participating in or receiving. And so I know there are engagement is not one thing. One of the ways that myself and some colleagues when I was at Northwestern broke up engagement was objective engagement, which is like the engagement that we can see in digital mental health interventions. So like logins, exercise completions, that sort of stuff. And subjective engagement, which is like how people are thinking, feeling, practicing stuff offline. And I'm not necessarily convinced that those are like the two monolith buckets, but think about engagement as being like pretty multifaceted, and like we try to design for different types of engagement depending on what the intervention is. And we have so much to talk about, so I'm going to stop there and hand it over.
Thanks so much, Emily, for that. And thank you for the introduction as well, Emily. I love to be surrounded by the two of you. And similarly, I had such excitement today coming in and saying, oh my gosh, I'm gonna be on a panel with such, intelligent, lovely women, and then also in a room surrounded by folks who are so engaged to learn more about how we can engage patients in digital interventions. So I'm super excited to talk about that. And similarly to Dr. Lattie, and I hopefully I'm pronouncing that right, please correct me. I don't think it's defined exactly the same way at even the various startups I've worked at. But one way that I like to think about it is, how are we tailoring things for folks to stay involved with whatever our goal is? So sometimes that may be just getting people access to the platform. That may be the initial goal when we're looking at program uptake or something like that. So engagement is defined in a particular way in that setting, right? Hopefully after that, we're looking at how we've tailored those interventions for them to actually get better with us or to get to another goal. And then I would say engagement metrics, or how we're thinking about that and how we're getting folks back on the platform or back into participating in those interventions may be slightly different. But overall, I think it's a lot about tailoring it to the needs of somebody and getting them involved with us in whatever that goal might be. So that's super broad, super nebulous. I'm happy to talk about it more, but I think broadly everywhere that I've worked, that's where we found the most success. And kind of defining the goal and working backwards from there has always been really helpful in making sure that all folks are defining engagement similarly as we work towards whatever the program goal might be.
I think that's perfect setup for our first question in the Q&A, which has to do with like execution of these goals that you care about. So the question is, how may digital mental health solve the issue that people can learn the skills like behavioral activation, but have difficulty executing? For example, they might say, if I can, I would do it. Since lots of interventions focus on skill teaching, I'm curious to see how digital mental health might address this gap in the future.
One of the things that this question brings to mind for me is that, digital mental health can mean a lot of different things. And historically, a lot of the work that I've done in the space of digital mental health has had a human support element to it, whether it be, a primarily clinician-led kind of intervention with a lot of digital mental health supports, or a primarily, technology led intervention with some lightweight human touch elements to it. And I don't know, I have worked on some more like purely self-guided stuff, but a lot of the strategies that I see around addressing difficulty with execution have often leaned into human elements for that. And I think with technological innovation, we may, as some of us were in the last discussion on large language models, we may be able to have programs that better support people in real time who are having difficulty executing. But I think that there's also ways that simpler programs can be designed to not just educate on what the skill is, like behavioral execution, but educate on common barriers to doing that, strategies to engaging with that skill and that sort of thing as well.
Yeah, so it's interesting bringing up the difference between engaging with a product, with a skill, that like it's so nuanced and you can think about engagement in so many different touch points, which is really interesting. I'm sorry, Nassim, I think I interrupted you.
No, I fully agree with everything that was just mentioned here, and also just empathize with the folks who, are sitting in front of somebody with these great digital interventions. They know that this is an evidence-based practice or skill that if this person could master, could really help support them feel better and get to their treatment goals, but you continue to run into those barriers. And I think that human element or that process is really important to call out, that it isn't this programmatic kind of robotic thing where it just happens perfectly in sequence that way. And some of our engagement strategies actually come from that human element, right? And recognizing somebody's readiness or motivation for change and really meeting them there, right? And making sure that the digital interventions are introduced or the skills are introduced at the appropriate time that somebody is available and ready to make that change or to learn that skill. And oftentimes that can be lost in this world because we tend to get very tactical and want to measure things. And I'm the first person in any meeting to say, like, what's the goal? What are we backing into? How are we tracking this? But also important to remind ourselves that not everybody's ready to go through a program perfectly and learn every single skill in that way. And so one of the things we did at TimleyCare, for example, was build different kind of entry points into care, right? Despite what somebody's particular condition is, they're able to engage with interventions at the level that they might be ready for. So perhaps it's self-guided, perhaps it's through like a peer-to-peer type of interaction, or it can be provider-led, right? So finding different ways to address the level of motivation is also equally, I think, as important as the skill that's being taught in the moment. So it is nuanced.
I think you already, again, nicely queued up the next question as you started talking about motivation, some of these factors. But a question, I'm interested, based on the definition Dr. Darcy gave in the keynote, of potency. Engagement is about getting people to do the elements that drive change. What do the panelists think we currently know about what drives changes in digital mental health?
Could you repeat that question real quick? I'll admit that I was looking at the questions that were typed that I can see in the
Oh,
queue. I think
absolutely.
that I was going to be reading while you were talking, and it wasn't one of those.
So it was interest in the definition that Dr. Darcy gave in her keynote about potency, where she talked about engagement being about getting people to do what drives change. And so the question was what you all think we currently know about what drives change in DMH.
Wow, that's a good question. I don't know if I have a really solid answer for that. I'm going to be like a terrible panelist on that question. I need to think about that for a second. There's a lot of different things that I could point to. One thing I'll just say is engagement, I think, is really about tailoring interventions to the folks who need them, right? And making sure it speaks to them. And so I think folks are more likely to change or be ready for change when they trust the intervention and they feel like that intervention digitally speaks to them. It's similar to how a person might. And how to arrive there, to tie the execution question in too, is really thinking about how you're gathering feedback before you're actually introducing this to a patient, right? Really being thoughtful about understanding what you're hearing from patients as you're doing beta testing, as you're thinking about who's in those groups, what kind of problems do they face, what kind of barriers are there to care, things like that. So, I don't think that's a maybe perfectly articulated answer to that specific question, but those are kind of the things that come to mind. And I'm happy to hear kind of like what other folks' thoughts are too. But I really think about how we arrive at that, and are we speaking to the right tailored intervention there?
Yeah, I think a lot about if we're thinking about interventions broadly, because different interventions target different things, that if we're intervening, we're typically trying to teach somebody something and then get them to do something differently, whether that doing is thinking about stuff differently or behaving differently or whatever that is. And in order to learn, and in order to make changes, people have to be motivated to learn to make changes, and it has to be at the right level for them. And so I think a lot of challenges that we see in digital mental health interventions not being well used or not appropriate, not like, helping people change to the degree that we want, is that there was a mismatch there, either in folks weren't at, kind of what the clinician might think of like a sufficient level of motivation quite yet, that there might need to be a motivational enhancement kind of intervention, or it wasn't deemed relevant, or it wasn't deemed, engaging in the midst of all of the other things that people have to do, because most folks nowadays are like fairly strapped for time and energy. And so we have to kind of think about all of the like little parts of intervention to get somebody into the digital mental health intervention, if we're thinking just like broadly about interventions as a space, to get people to engage and move forward.
Great. So the next question is kind of getting us into the nitty-gritty a bit more about operationalization. So the question was about how we interpret different metrics of engagement, and maybe you all could even talk about what metrics you think are most important. And the qualification here was, as a clinician, we can see patients engage in skills in session and discuss their use of skills from the previous week. But with many digital interventions, we don't have that ability to speak with clients. Oftentimes, all we see is that they logged in or for how long they look at a screen. So maybe you guys could talk a little bit again about what metrics you use, what you'd like to see used more, and maybe how clinicians, when you guys talked about human support, how might they use those metrics?
Yeah,
Emily?
I'll go first. I feel like there's so many things to talk about here because there's so many different like brands and shapes of digital mental health interventions. And one of the things that I remember thinking was super interesting work that we had done before was seeing that like the objective like login and activity in the system didn't relate super strongly to program outcomes, but ratings of how like useful, helpful, engaging people found the intervention while they were in it did relate to outcomes. And I think there's a really interesting hard balance to strike in that, especially when we're deploying or disseminating interventions at like a broad public scale, we don't want to bog people down with assessment measures because like quote unquote real users are going to respond differently than people who signed up for a research study. But that there is a lot to be said about getting like brief feedback on how useful, helpful something was, whether it's like, you know, star ratings or thumbs up, thumbs down kind of stuff, or ways to give feedback if there is a human in the loop around it, that can really drive a better understanding of how people are, you know, internalizing and then moving forward with what they did. Because I don't know, it probably doesn't surprise many of you who have ever interacted with me before. I'm like a big nerd. And if you give me assignment, I'm going to get my assignment done so quickly because I like to get stuff done. But it doesn't necessarily mean that I like practiced that skill. It means that my objective use would look great. But outside of that, it might not be. And I think we have to keep close tabs on what objective engagement looks like and means versus the, you know, the skill application that we might be able to build in very lightweight assessment of.
Yeah, definitely. I agree with everything that you just said. And I'll just add, I can't say this enough, but more often than not, I think folks don't necessarily set out to build a program with a specific outcome in mind. They're like, oh, this other company's doing this, we should do this. And there's a lot of just like ideas floating around. And so you might find yourself disappointed that you only saw somebody log in, but sometimes that might be the goal, right? And if you're able to set out at the beginning of designing a program and implementing a program to say, you know, our goals are X things, you're not going to be disappointed by that, right? You'd be like, oh no, we actually got the users in, we are doing X, Y, and Z. Now, if the program outcome is hopefully to get folks better and to make sure they're engaged, you know, with that particular intervention more than once or on multiple engagements, and you don't have access to that, that's where I would say, okay, now there's a problem, right? You haven't designed the program in a way such that it can meet the outcomes that you're hoping. So how do you fill that gap? How do you back up a little bit and make sure that those touch points are in place? And when you have that alignment and that definition up front, it's actually quite easy to define what measures and outcomes you're looking at, but sometimes it's just getting that general buy-in and making sure everybody understands what the actual outcome is and what success might look like before you get started, to then maybe not be disappointed when you hit certain roadblocks or things like that.
Speaking of like those goals and the outcomes that you care about, the next question has to do about potential differences and how you might define engagement or those targets, differences between academic and industry settings. And specifically, there was interest about considering that sometimes long-term engagement might not be good strategy from a therapeutic perspective, but often companies need continuous engagement for financial sustainability. So given that, you both kind of straddled clinical, academic, industry now, do you see there being a difference across these different settings or different priorities?
I'll jump in to say absolutely, of course. Yeah. I would say that just from where I sit, I've kind of historically in my career sat right at that intersection of clinical and business to make sure that we're building the right programs that meet the needs of the business, but they're still clinically rigorous and do the best for our patients. And I would say, for example, at TimleyCare, I just use that because I'm here now, but they actually really care about utilization of services. Our partners do. They upfront maybe cared less about program outcomes of like how many people reached remission and how many people, got to these places that you might have cared a little bit more about in an academic setting, right? And so there is that moment of having to really understand what is the goal of a particular outcome, because you're not just at program outcome, because you're not only serving the patient, you're also serving the payer, which can be quite a difficult place to be, right? Because you might be like, well, I don't need X amount of people to just like log in. I actually want these folks to get better, but you might need to track both, right? And take that position of success for, hitting the right amount of utilization or whatever that might be, to then say, and I'm teeing you up that we should really actually care about these outcome measures as well and kind of go from it from that angle. So I think it's totally different, but it's certainly not something that's not achievable if we sit down and think about it a little bit.
Yeah, I agree with what was just said for sure. And I think something that's valuable to keep in mind is that so like industry is not like one thing, and different businesses have very different financial structures. And there are some companies that their financial sustainability does depend on users of their product engaging with that product in super long-term capacities. And there are places that their financial models are set up more around like measurement-based care to get people in, to get people better, and to get people like moving forward in a connected kind of way. And so I agree that there are differences between like academic engagement for digital mental health interventions when we're doing like RCTs and stuff, and in how engagement matters to different companies. But it seems to differ fairly dramatically depending on what the structure of the company and what their digital mental health intervention or technology enabled mental health service like array looks like. And so I think part of the job of clinical scientists and clinical leaders in the digital mental health space is to be engaged and advocating for how we're putting like client wellness, end user wellness, therapist efficiency, whatever those things are, front and center, because most people are in this space because they really want to do well and help people. And some business models start to drag that down a little bit, but not all of them do.
Yes. And I just want to really double click and emphasize the last thing that you said. This is just purely from my experience. This is not rooted in fact, but I think it is true based off of all of my time in the field. I've always kept patients kind of best patient wellness, best everything as my guiding North Star. And it served me well, right? Because you build the right programs, you measure the right things, and the business gets to reap that benefit. I'm not saying that it's that easy. It's a lot of conversations. It's a lot of educating folks. It's a lot of getting buy-in, but that's how I've kind of approached it and kept it as my guiding North Star. And things have kind of fallen into place there. And so I don't think there's a person on this screen that would disagree with that or not have that value as well. But it gets kind of hairy and complicated, when it's happening in execution. And I think that's just really served me well. So if you walk away with that, in your heart, it's right. And you're going to be able to find the right ways to engage patients, do the right things for them. And the business model kind of falls into place from there.
All right, next question is assuming that good engagement looks different in everyone, but there might be patterns or subgroups. How do we move towards identifying different user engagement profiles, and how do you envision that we apply this in practice?
The data is your friend, is what I would say to that. The data will tell you a lot. If you're looking at it and really thinking about it, it'll tell you all the areas you should be looking, and what questions you might have and where you want to start strategically building the right kind of interventions and then breaking off a little bit at a time, right? You're not going to be able to hit all 100% of folks like 100% engaged all the time. But if you're looking at data, if you have, good friends on the analytics team, if you're curious and you're not going to let it stand in your way that some folks might not be engaged, you're definitely going to find a lot living in your data and how you can break that down to solve the different kind of profiles that you might be looking for. So I always tend to start with the biggest and broadest, make sure that I'm kind of hitting that. It's the most scalable. And then I can kind of break it down from there to say, okay, what am I missing? Something about this big, broad thing is missing folks. Who are those folks? Why? What's the problem? What are the barriers? Sometimes it's easy things to fix, sometimes it's not, but I always let data support me there. And then you can kind of get the follow-up interviews, questions, et cetera, in place to better understand what's not serving some of those folks who aren't engaging in the way that you had hoped or anticipated.
And to add on to that, as we think about how we can identify different kinds of user engagement profiles in diverse sets of interventions and services that are being developed, and how we can apply this in practice, looking around the virtual room of names, I know that there are some like brilliant data science and quantitative people here, and there are also a lot of like brilliant, very clinically minded people here, and a lot of folks who straddle a whole bunch of areas. And as somebody who leans a little bit more on like the clinical research side of things, one of the things that I've seen be so incredibly important is to stop and pause before launching stuff about thinking of what are the like reasonable hypotheses and hunches that people have, and make sure that your data infrastructure is being set up to gather those things so that you will be able to see all of those different points. And I, remember several years ago working on a study where we were trying to replicate something that had happened in a previous sensing study, and it didn't pan out. And then when we kind of like looked at the data that we had collected, we realized that there were some demographic items that we had really strong hypotheses on would have been like good explanations that we hadn't captured to be able to tell. And so taking, building out the infrastructure for data collection takes time, it takes money, it takes additional people and power. And if we're thinking about how we are looking a few steps ahead to be able to, beyond, initial pilot, beyond like the V2 of something, continue to like adapt and tailor, it's very important to invest in that early so that we can get those initial insights and learnings to be able to spin off from there.
So next question coming in is, I appreciate the idea of starting with the goal and working backward to define what engagement means. Of course, goals are going to differ depending on context. Company goals, understandably, are related to profit. The theory behind CBT is to train people to be their own therapist. Do you think it's useful or possible to develop a near universal definition of engagement? I think, Nassim, you talked about like that you didn't think the two priorities were mutually exclusive, that you could kind of meet in the middle. So maybe you could start, like, have you in your experience found ever a universal definition, or is it more about balancing alternatives?
Oh gosh. I think that it's always a balancing act for sure. But I think when I've seen folks get as close as possible, one area we're tending to be a little bit obviously more on the clinical side of in these conversations, but sometimes these interventions, one thing that's kind of like unspoken here is that they're successful because there's universal buy-in from the company. I'll say that again. There's universal buy-in from the company, right? So you could have the best, most beautiful digital intervention program designed, and if you're the only person and you and your 3 teammates are the only people who think it's beautiful, it's really hard to get that in front of folks, because if marketing's not invested, they're not going to do that. And to get to the data collection piece, I mean, I couldn't even nod my head fast enough, because the infrastructure that the company has to invest in to make sure that you have enough data scientists, you have the data infrastructure, it's HIPAA compliant, it's all the security, all of the things. I mean, we're like one slice of it. And it is really, really hard unless there is buy-in from the entire company that we believe that we're going to put our eggs in this basket and put it forward, because we have enough of a reasonable hypothesis to believe that this will work and do well for our patients, our customers, et cetera. And so to get back to the question of the goal, right, is maybe zooming out a little bit to say there's going to be programmatic goals, right? And most of the folks in this room are probably either therapists or work really closely with a therapist, but sometimes your secret power in these rooms for getting buy-in is using some of your therapy skills to get folks to arrive at what they're kind of a similar goal without realizing that they're actually a similar goal, right? Someone's going to come in from data and say what they want to say, and then us clinical folks come in what we want to say, and sales is like, and all of that. But zooming out a little bit to understand what the dynamic is in the room, making sure you're hearing folks, reflecting it back, getting them to land on something, agree upon it, is probably your biggest secret weapon, that will then allow you to identify that goal and work backwards, right? So I just wanted to mention that buy-in piece, because I think there are so many talented folks who, don't need me, don't need like anybody. They could go out there and just build something that any of us would look at and say, this is great. Like, it's perfect. I think it will be, highly engaging. I think it'll get folks better. It's, up to clinical fidelity and blah, 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 blah. But if, every cross-functional team across the company doesn't necessarily feel invested in that, you're not going to get the engagement either. So it's both, patient engagement, but also engagement of your peers and engagement of the business. So don't overlook that piece as you're identifying what the goals are, because that's where you really find yourself in that happy-ish spot where you're right in the middle. So that's what I'll say about that piece.
I will just briefly say plus like 1,000 to everything that was just said. I think one of the things that we can sometimes lose sight of is that mental health experts often have like people leader superpowers, and a lot of success in getting alignment on things is understanding what people's wants and motivations are. And if you have, good folks across teams who want to be doing well, and often this space we do because people recognizing there's a mental health crisis and are trying to contribute in ways to like make the world better. If we can get teams aligned on a shared excitement, shared vision, I think the shared definition of appropriate engagement is like a pretty natural follow to that. But we can't assume that every team within a company is going to have that same expectation of what engagement success is going to look like if we're not taking the step back to be talking about that early, and then often as new things come up too.
So you both already started talking actually about the next question, which was who the different internal stakeholders should be when defining engagement and what those like outcomes and metrics of interest are. So rather than make you repeat all those different teams again, I'm curious if you could share perhaps like any teams that have surprised you, maybe as a clinician or a scientist by background, that their perspective you actually think was a surprising like value add to the operationalizing engagement for your product or service, that maybe folks on this call haven't thought about.
I have not been surprised by anyone because I very naturally assume that everyone has better ideas than I have most of the time. But I've been really happy with insights that I've like gleaned and ideas that I've heard, particularly from like design partners, marketing partners, are like at my company, our like customer success team, who are working very closely with our larger clients that like, bring ideas and insights back. Like often, I don't know, I feel like I'm constantly getting like really valuable, good ideas and insights about how these things are working and can continue to work better. That, I'm one of the mental health experts in the room, but we live and work in really complex systems, and a lot of people have so much more expertise in different aspects of those systems than I have.
I love that. First of all, I know it's hard to say, to be like fully surprised, but I think design is always, I think product designers are like the other side of our brain. Like they're very much thinking about things in a similar fashion. So I would definitely agree with that. And I will say one stakeholder that I didn't work with as much in like direct practice, but I work with a lot more now in the mental health startup world, is like a strategy and operations person. So these people tend to be like former consultants, and they're just really insane wizards of being able to articulate value in a business sense. They're incredibly good listeners. They're really able to take in a lot of complex information, distill it down into the top couple of important key takeaways, and then translate it into business terms. So that I've learned a lot from working hand in hand with a lot of strategy and operations folks throughout my career. And I think that that's been particularly helpful. So I would say that the traits that they have, though, is that they are really, really good listeners. They're able to distill down information into really easily digestible key themes. And then they're able to translate that into kind of like what's important for the business. And so I've learned a lot of things from them along the way and kind of picked up how to do that myself along the way, but certainly not as fast or as beautiful as they do it. So I will say that that's one that's just to add to the mix, but I'm fortunate to have worked with a lot of great folks.
Next question is, want to hear your thoughts on strategies or insights into improving uptake and engagement for users from diverse and often minoritized backgrounds, and how we might integrate these considerations into the development process.
You want to go first? What you want to go? You go first, Emily.
Okay, sure. Yeah. I often kind of think about it similar to how I'd answered a question before about how if we're thinking about for an intervention to be, successful, we want people to be oftentimes like learning something and doing something differently. And for that to happen, there needs to be a perceived like fit and value to an individual person. And so I often have been thinking about how it really, like, if we're talking about new things, it really has to start with thinking through who we want to be serving, the differences between folks that we want to be serving, and using all available like energy, effort to ensure that what's being developed will feel like it fits, be applicable, be a value add for different people's lives. And I think one of the, mistakes that has often been made in building and testing things in very fast-paced ways is testing stuff with the first people that we can get to engage, which are often people who are already like very pro mental health or very pro research, and then we move forward with that thing that was really only designed for this group of people. And so, taking that step back to map out where needs are and where barriers are, to move from there.
Can I just say what she said? No, that is incredibly thoughtful response, and that's what I would add to just as like a key takeaway is thoughtful design and program design actually gets you pretty far. You're in this high, like fast-paced place, and you're like, get this done, business needs, right? Like we've all heard it, but really advocating for some time for thoughtful design, thoughtful think through, do your literature reviews, talk to people, understand the nature of the problem before you dive right in and like just do something, because there's a lot of people who can just like do something, right? Like that's like documented everywhere. Like CBT doesn't really change amongst different things, but how do you actually deliver it thoughtfully to the folks who need it, who might not be engaging, that you're trying to make sure get through the door? And so all of that is to say, be thoughtful. I don't have like a really like unique thing to say other than take the time that these folks deserve, right? You're trying to find a way to open the door for folks who maybe have never had the opportunity in the past. So traditional ways might not work, right? And you have to be very thoughtful about how you design something so that folks feel almost signals of trust before they even touch or engage with anything. So that advocacy piece for that time to think it through is super important, because that's typically, I think, where things fail, right? It's like, oh, look at these folks that Emily referred to, like they're super great. They're interested in mental health. They're advocates. We saw the results we want to see. Like, let's expand, blah 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 blah. But Emily pointed out something right there, like, well, did we get everybody in there that we actually needed in there? Why or why not? Maybe we need to think about how we even design the process for folks to opt into this. Were we really inclusive about that, et cetera, et cetera. So there's a million ways to do it, but even just that thoughtfulness of asking yourself that question and even challenging your own methods of like, was that the right way to do it? Maybe, maybe not. And what did I learn? You know, one thing my team and I do all the time is we finish a project and we're like, okay, tell me everything you learned, because we would do it differently next time if we knew we had more time or more time to think through X, Y, and Z. And you learn a lot from folks. I mean, like, I'm listening to Emily right now and I'm like, I can think of a couple things. Maybe I should probably go back and say, how did we design that? How did people opt into that? And that was just sitting here, just enjoying the conversation with you all.
One thing that I do want to say after listening to myself talk to, when I know that when I've said something similar before, I've gotten pushback of like, Emily, you are overly optimistic about a lot of things. And there are a lot of real world pressures, oftentimes like finances, budget, that sort of thing. And so one thing to like circle back to something I was talking about earlier for is if there are those like budget limitations, pressures to deliver something, I also like really advocate for, if you can't do everything as well as you want to now, try to really invest in like that data collection infrastructure so that when things inevitably probably don't go as well as one is hoping with like a pilot or initial launch of something and reaching more diverse, underserved audiences, you have concrete data to show why it was a problem that was done in that way, to try to garner like additional time investment in more more equitable methods for that like second launch or the version 2 or the updates that are being made, because I do recognize both in academic and industry senses there often are time and money pressures.
Yes.
But if we're trying to serve everyone well, I think there are a handful of different ways, both from like pushing back, pausing as much as possible at some of the initial design, and being really thoughtful about data collection to like build good cases for why we really do need to be doing this.
You both have highlighted the importance of good data from the start. So diving into that a bit more, what strategies have you found most helpful in practice to tackle the high complexity and irregularity of objective engagement data, such as clickstream mobile analytics data from open-ended usage for mobile apps, which themselves might be getting updates? For example, zero in on particular features or metrics, use AI, ML, etc.
I will be fully transparent that this is not my real forte as a researcher, and I have like very heavily relied on talking with folks who have much stronger quantitative chops than I do to try to identify like, if these are the things that are important, what are best practices that we can be doing here. So I wish that I had more knowledge to answer this. I don't.
I actually had the same thought. I was like, I actually don't have a ton. I haven't had to dig in the programs that I've built and managed on that as much. So, gosh, I'm stumped for 2, I guess, today.
Sorry.
Yeah.
I know there are smart people in the room, so if anyone has really great responses or what they even deem like mediocre responses, feel welcome to throw those into the chat, because I think we all want to be learning from each other.
Well, pivoting to another question, when reporting success rates to your stakeholders, how do you account for dose effects, which have been reportedly shown in many intervention RCTs and meta studies?
I will say for me, actually, that is a fantastic question, but I don't even think I've had to cross that bridge yet, because I've had to get so many folks invested in just understanding that measuring like care and programs is important. And we're really at those preliminary stages. I would love to get to a point where we are talking about that, but I will say when we're venturing out for like a V1 of these kinds of things, it's actually so much higher level that unfortunately I haven't been able to dig in that deep. I would love to, but it's just really been, marketing like doesn't really know or like care, right? Like not care, but like they might not see that as one of the aligning metrics to the business. And so it kind of depends on what types of companies I think you work at, what the proposed outcomes are. Like if we were like a heavily research type of focused company, I think I would have a very different response for you. So yeah, that's where I'll leave it. I don't know, Emily, if you have a different experience, but that's what I can say about mine so far.
Yeah, I don't.
Um, Next question. Sometimes clinical scientists or clinicians on product teams are expected to single-handedly improve engagement within industry settings, which can be a tall order. Can you speak to whether you think a diversity of perspectives is useful in terms of driving meaningful engagement? And if so, why? If you could assemble your dream team and product to drive meaningful engagement, who would those players be? And maybe you can like throw in like this term meaningful, like to the degree that you're comfortable, maybe say a little bit about the products or services you're currently working on to give some context.
I will say first, I definitely think a diversity of perspectives is useful in terms of driving meaningful engagement. As a psychologist by training, I think about meaningful engagement primarily as like, I've said a bunch of times now, like people learning some new stuff and then doing things differently and making changes to their lives to hopefully feel better, because that's what I would love everyone to be able to do. In terms of like a dream team to drive meaningful engagement, I feel like it would really depend on what the like product or service is. But in my current environment, I feel like I learn a ton from product designers, sometimes bringing in ideas around driving engagement that I'm like, yes, of course we should be doing that. And other times bringing in ideas around driving project engagement that I'm like, oh, wait, no, that's counter to how we think about things from a mental health services like intervention perspective. And it gives me the opportunity to like better clarify why I think about something the way that I do and get alignment on that as well. I also feel like I've been learning a ton from at my company from our like member marketing folks about how strategies for engaging people who are not yet in an intervention, but just like kind of that broader thing. And so those are two quote unquote like types of people I would want on a dream team. But beyond that, I feel like it very much depends on what the service is. And as I'm saying that, my brain is moving faster than my mouth is talking, because that's what happens to me. And I'm also thinking about how I think I've been really fortunate to primarily be in work environments where people are bringing their professional expertise and their lived experience expertise as well. But if I was not in environments like that, and even being in environments like that, I think making sure that we have folks with lived experience in what the intervention is aiming to accomplish is incredibly valuable in figuring out best practices for engaging.
Yeah, I love that response. And gosh, that is a tall order to single-handedly have to change engagement for how many millions of people your platform might serve, right? But I would say it's not gonna be like, the hot answer of the day, but like I would really lean into the data. The data is really telling you a lot. And it's telling you where you should be potentially looking at leaning into interventions. And oftentimes when we go back to that buy-in part of the conversation, folks are going to interpret situations differently, right? And folks oftentimes, in the environments I've been anyway, have a really great response to the data and to what the data might be telling us to generate some buy-in versus like hey, this isn't working. Hey, we need to change this. Hey, so be mindful of like who you're talking to, what's going to resonate with them, how to talk about it. While other folks, I can say they're just like, oh, I trust you. Like you can just move it right along. That's less rare. You got to earn that one. But, you know, I would say really just lean into the data. And then I mentioned earlier that I had like strategy and ops folks that I've worked with. Oftentimes I've been able to work with those folks to do some financial analyses for me. So, you know, we do work in the business context, and sometimes I would have to make actually a financial business case to do something versus just saying, you know, this is best practice or we should do this thing, because but that also just ties back to who am I talking to get the buy-in to put in a particular type of intervention. And sometimes I'm talking to design folks who get it and they, you know, we can just talk all day and move straight along. Other times I'm like, I'm talking to John in finance and he's got to see a business case to better understand why the next 3 months I need to tie up X resources to do this thing. And he's only going to understand spreadsheets. And I was not trained in that. So I lean on my partners and my teammates to support in those areas too. So really being thoughtful about who's sitting in front of you that needs to kind of support and bolster what you are working on is really helpful when you're trying to move these initiatives across, because you're right, like you can't do it by yourself. That goes back to that huge kind of cross-functional buy-in that's required to be able to develop the right interventions for the folks that you're serving.
I think that's a lovely note to end on, just really encouraging us to think about engagement in a multifaceted way with lots of perspectives, lots of data. And I just want to thank you both so much for sharing your perspectives. It's really been invaluable. I also have been rapidly taking notes for my own work. And thanks to everyone in the audience who joined. Hope we can all keep connecting about this in the future. Thank you
Bye.
all.
Thanks, everybody.
Thank you.